Good morning, everybody. I'm Andrew Davis, CEO of Autism CRC, and your host for today's webinar, which is the third in our Autism CRC webinar series for Autism Month, April. Our Autism Month webinars throughout April share some of our latest research and outcomes across our three programs: the early years, the school years, and adulthood. Today's webinar is focused on adulthood. But before we get started, I would like to let you know that you have the opportunity to submit text questions by typing your questions into the questions pane, which is fortunate, on the GoToWebinar control panel. This should be appearing on the right-hand side of your screen. If you would like to send a question in, please include the name of the presenter who your question is addressed to. You can send your questions at any time during the presentation. We collect them and address them in the Q&A session at the end of today's presentation. On to today's topic. In Program 3 of the CRC's program, Adulthood, we are improving opportunities for people on the autism spectrum to successfully participate in higher education and employment, and identifying best practice in physical and mental health management. There has never before been such a multifaceted, collaborative research effort as the Autism CRC, focused on post-school outcomes and improving the well-being of adults on the spectrum. Today, we will be joined by Matt Ormiston, who will speak about ANZ's Spectrum program. Rochelle Johnston from ANZ was also going to join us today, but unfortunately she is unwell and has had to send her apologies. We will also be joined by Dr. Anna Krzeminska and Dr. Anna Urbanowicz, who will share with each of us the latest information about Autism CRC's Program 3 research projects in employment and health and wellbeing. Our first presentation today will be from Dr. Anna Krzeminska. Anna is an Autism CRC project leader and associate professor within the Department of Marketing and Management at Macquarie University in Sydney. She is also a co-founding director of the Queensland Neurodiversity Hub at the University of Queensland. After completing her PhD in Germany, Anna held academic positions at Leuphana University in Germany and Holt Business School in London, the University of Technology in Sydney, and the University of Queensland's Business School. Anna's research and teaching expertise centres around exploring strategic management issues of social impact organisations, such as the design of socially and commercially successful business models, as well as leadership and governance practices within those organisations. Today, Anna will be speaking with us about the research she is undertaking on behalf of Autism CRC into the benefits, challenges and effective practices of globally leading companies in skilled autism programs, as well as her work with the Neurodiversity Hubs. Over to you, Anna, and thanks for your presentation.
Thanks a lot, Andrew, for this lovely introduction. I'm very, very pleased to be here. I'm just sharing my screen now. Can everyone see the first slide?
We can.
Yes, thank you.
That's great. Okay, fantastic. Well, thanks again for the lovely introduction. It's a real pleasure. It's a real pleasure to be participating in the webinar and sharing a bit of our journey and work so far within the skilled autism employment research that we're doing, and also the work with the neurodiversity hubs. So basically, what I would like to talk about is a little bit about both of those activities, because they are interrelated, and this is, I think, also one of the beautiful things about this research project, that it is not only about research, but it also is actually in like directly implementing implications, activities coming out of this research and coming out of the collaborative work that we're doing with the organizations that are leading in this space to then directly benefit individuals on the autism spectrum to gain skilled employment. So I will be talking a little bit, the talk will be a little bit, interwoven with both the Neurodiversity Hubs, and just to give everyone a bit of an insight on what that is. So the mission of the hub is to facilitate high quality employment opportunities for neuroatypical students by matching them to appropriate paid work and internship experiences. So the Queensland Neurodiversity Hub, which I co-founded recently, is the second one after the Swinburne University of Technology one. It's in collaboration with, spearheaded by DXC Technology, but there are also other partners strongly involved, such as ANZ, that we'll be also hearing about by Matt Ormiston, but also SAP, other organizations, government organizations that are participating in the Neurodiversity Hubs. And the work of the hubs is the purpose is to inform and engage employers on neurodiversity with the aim of identifying appropriate paid work and internship experiences. So we work with organizations to identify opportunities that they might have to employ or give internship opportunities to students on the autism spectrum. But also having it a little bit, that's also why it's called Neurodiversity Hub. We're starting with the autism spectrum because this is where the research currently is the strongest that we're doing, but we're also looking at including other neuroatypical students. So that would be also students, for example, with ADHD or PTSD, something like that. And then we identify those students and support them to gain access to appropriate paid work opportunities. I have included in the slides so that we have the opportunity to share and to the participants of the webinar to see more information, links to media releases about those hubs so that they can have a look at what we've been doing there. And that has been, coming out, out of the research and development that we're doing in the space where we do autism employment research, and I'll talk a little bit about that. And then the hubs will also be a vehicle and a platform to then also disseminate the findings both to employees and employers, where we can then offer long-term. The long-term vision is because it's all obviously very brand new, just only recently started, where we'll be able to in the future then also provide training opportunities for students and employers in that space. So let me briefly talk about, and before I quickly jump on this other slide, I've also, for the research and development, I've just also added a few links on where participants can read up a little bit more about the research. One is just a recent article that just came out this month in the Disability Link magazine, and from the AIBE website on the research projects. So the research, we have two current projects. The big one that we're currently doing on behalf of the Autism CRC and in collaboration with DXC Technology is on the challenges and most effective practices of scaling and sustaining autism employment. So small organizations have started autism employment on a smaller scale and have been spearheading in this area. But now that large organizations such as DXC Technology, ANZ, SAP are starting to look at employing people on the spectrum on larger scales, we need to understand how these, what does it actually mean? How do we create organizations that are autism employment friendly? And what are the practices that organizations have developed to sustain that? What are the challenges and how they have overcome those, and what are the changes in structure, culture, practices? Because it is a cultural change, and that is also I think the interesting element of this research is it's not just about benefiting people on the spectrum. Our long-term goal is also, once we have created an inclusive, that will create not just an autism, but a generally disability and diversity inclusive organizations that will benefit everyone, including the people with autism. So that's kind of the bigger picture. And we're also looking into understanding what are the perceived costs and benefits of those organizations. We're working with global organizations that are leading in this space. So this is DXC Technology, SAP, ANZ, to understand what organizations are doing. We have that as part of the grant that we have been awarded, which is by Autism CRC and DXC Technology at 383,000, which is both cash and in kind. We have a smaller grant as well, a smaller research project where we look at the mental health framework, because one of the big issues, one of the specific challenges that have been identified already through our preliminary work is that people on the autism spectrum have what are called comorbidities. So they also suffer from usually high levels of anxiety and depression. And that question then, of course, becomes is how do managers and co-workers deal with those issues in the organization. So that is another smaller project that we are running with the Australian Institute for Business and Economics, where we've got a 40,000 cash contribution. There are further grant applications in preparation, and there is also a special upcoming special issue on the advantages and challenges of neurodiversity employment that we're guest editing with our global team, because this is also an interesting element of this project, is where we're working with leaders, global leaders in disability employment, autism research in the space, which is including Suzanne Briere from Cornell University in the US, Rob Austin from Ivy Business School in Canada, and Darren Hadley from La Trobe, and the whole team at the Olga Tennyson Research Centre at La Trobe here in Australia. And our preliminary findings, so just as we've, we are in the very early stages of this research with the contract just being, in the process of being signed, but we have done preliminary research, and and of course we need to, treat this a little bit with caution, but I think I would like to share a little bit of that. And I think what is interesting is that we looked at the motivations of organizations to get involved. And what is interesting is that prior to so we've looked at organizations that are interested in implementing an autism employment program, and those that already have done that. And before organizations, prior to implementing those programs, the main motivation is that what we have that as a decision making is actually person involved. So we can see that that this is an important element also that will be important in scaling those, as we'll be identifying the right decision makers in organizations that have some level of personal involvement with autism, which will help to also then push those initiatives in the organization, and organizations see it as a reputational benefit. What is interesting then is that post-implementing, they actually can see a very clear business case. So they can actually see that what is also really important for those programs is that it's not just a reputational or a CSR initiative. Actually, quite the contrary, organizations trying to make the strong case that this is also a business case for them, that they're looking into talent, and that that the huge also benefits that people on the spectrum bring to the organization. So that it becomes really clear once organizations start to implementing those programs. Still, the reputation is an important element, and the organizations also see that it benefits the broader diversity strategy that they are running within the organizations. The benefits is clearly the access to talent. So organizations, particularly interested for organizations, currently in the IT space, so cybersecurity, data, conversion, IT testing, and software programming. All those things are really the main areas at the moment. But we also see, and this is also part of the Autism CRC's work, is we can also identify also other organizations, for example, in with Sunpork in the piggery. So there are actually quite a broad range of organizations that will ultimately, think benefit from the talent that people on the spectrum bring. But this is one of the main motivations. It's also to become a more inclusive culture. This is what I've just already highlighted, that it's just about also not just for people on the spectrum, but becoming a more inclusive and diverse organization. What is another very interesting element in this space is that it facilitates collaboration with other organizations, and this is what I've seen coming from a business background. I've worked a lot with organizations, and mainly organizations are are competitors in the space, right? But in this particular instance, you can see the collaborative a willingness to collaborate in this space. Organizations such as on the upcoming summit in Seattle at Microsoft, and last year at Palo Alto, hosted by SAP, we saw how keen organizations are to have this inclusive meetings and summits where everyone comes together, including research community and those organizations, to share the best practices in the space. So this is another big, I think, advantage of organizations taking a part in those programs. Increased productivity. So I guess this is a big element. So we have first, data from anecdotal evidence from organizations such as DXC that they finished projects in a few months that was set up for to be taking a full year. improved innovativeness for those organizations. So they're also looking into, developing, innovations from, benefiting from the diversity of including people on the spectrum who are, just thinking differently than the neurological typical people. It's also the mentoring budding. So there's also this element that, people in the organization that, become a buddy or a mentor for a person with autism actually benefit quite a lot from that experience. We have a few stories that we've also shared at the recent launch of the Queensland Neurodiversity Hub with a government organisation here in Queensland, where the participant was just saying how life-changing this experience was for her to actually start working with this program. And then things like an improved retention rate, improved employee engagement. So basically the employees are really also proud to be part of the organisation that is actually implementing such a program. And this is also how it links to the neurodiversity hubs, because the neurodiversity hubs are also designed to obviously facilitate those. So we will identify talent, so we will help organizations to access that talent, and then we will collaboration with other organizations, because organizations come together at the neurodiversity hub with the students. This will also facilitate collaboration. We will be looking at improved innovativeness and productivity through providing training to students on the spectrum, so that when they actually enter the organization, are already more work ready than they were previously. So all this also fits into how we work with the neurodiversity hubs there. Of course, there are also challenges that organizations have reported. It is they underestimate sometimes the amount of support required, because it is important to understand that, particularly in the beginning of the hiring process, there is support required. So you cannot just put people into the workplace and assume that they can just hit the ground running. There is support required. There is also already evidence of what are the best practices, as in there is the job coach or an autism consultant, as DXC has implemented it quite successfully with government organisation in Brisbane. And there are other things like the budding system, employment in groups, in pods, basically, so that people on the spectrum are not employed as a lone individual, but there are actually teams that not only have other people neurological typical, but also neurological atypical people on the team, so that they can create friendships and the sense of community there. Also, the supply of qualified candidates. Again, this is where the Neurodiversity Hub can help in both of those elements. So we can try to take on board the support requirements that organizations have, and provide some of them already through the hub, and where we can, and then we will supply the qualified candidates. It's the transition from the proof of a concept program to a mainstream program, because of course the ideal scenario is initially organizations will start it as an affirmative action program and a special program, but the idea is to transition this to a mainstream program. So this is also why the culture of the organization needs to change long term, to enable this, so that people on the spectrum can normally apply through the normal process, not to have to go through some special autism employment program long term. And as I've already mentioned, existence of other mental health issues in autistic employees, which is, just needs to be managed as in other accommodations for not neurological typical people, which also, and this is sometimes a bit of a myth, is that organizations who are a bit skeptical about autism employment have a bit of a fearful of the level of accommodations that they need to make. But the research has shown that this is actually not true. Accommodations for neurological typical people are actually just as high, or sometimes even higher, what organizations do just for people who have, for example, kids that they need to have be picked up earlier from school, or part-time work engagement, things like that. So for all of that, we will identify best practices through the research that is also upcoming. Some of it will be then picked up through the Neurodiversity Hub, so we can provide the training, and more research is also underway in collaboration with the partners that we have. And just to close this here, so we have an upcoming employment. So to also then have that, we have an upcoming employment opportunity at the Queensland Neurodiversity Hub, which is with DXC, the Dandelion Work Experience Program, which will be running June, July, and in Queensland. Focused at the moment at students on the from the University of Queensland, but if some of the participants are interested who are not students at the University of Queensland, please do contact us through the website of the hub, that I would be also happy to share. so because we're working also on ways to include people who are not students of University of Queensland, but are still seeking, the opportunities through the hub, how we can, get them involved as well. So just to close that here for the participants, that might be an interesting information, that there is an upcoming work experience program in Brisbane with DXC that will hopefully then long-term lead to employment. And I realize I probably, used up all of my time, so I will finish up here, but we'll be more than happy to take questions after, everyone else has presented. So thanks a lot.
Thanks very much, Anna, for your presentation. As Anna said, she's happy to take questions, as I'm sure all our presenters are today, at the end of the session. And just a reminder that if you do have questions for any of our presenters, you can type them into the questions pane on the GoToWebinar control panel, and we'll go through as many of these questions during the Q&A session at the end of the webinar as time permits. Our second presenter today is Matt Ormiston from ANZ. Matt spent his younger years in the Northern Territory, growing up in the small remote mining town of Nullumboy in Arnhem Land on the Gulf of Carpentaria. With a degree in science, the spirit of adventure led Matt and his young family to take up an international assignment in New York, where he led a transformation of the technology culture for an Australian investment banking firm to deliver better quality outcomes and services. After returning to Australia, Matt joined ANZ in 2009 to lead the Asia-Pacific desktop transformation across 27 countries, working with local teams to improve this key element of the employee experience. Now the head of technology for corporate optimisation, Matt leads the team helping ANZ's corporate centre get the most from their strategic, finance and HR systems towards achieving the bank's purpose of shaping a world where people and communities thrive. In line with that, today Matt will be speaking with us about the ANZ Spectrum program, which recently employed numerous individuals on the spectrum in ANZ Bank's group cybersecurity and testing teams. Thanks for joining us again, Matt, and over to you.
Thanks, Andrew, and thanks for the opportunity to speak with all of you on the webinar today, and just to recognise the many gifts and talents of autistic people and share what ANZ is doing in the area of employment. I'm sure all of you are aware of how dire the employment situation is for autistic people, and I imagine some of you are facing that challenge or know someone who is. So I'm not going to talk further on that. Instead, I want to share our journey in the area of autism and employment and the early results we are seeing. At ANZ, one of our first partnerships in this area was with the Autism CRC when we hosted the App for Autism Hackathon. And on the last day of that event, after all the awards had been handed out and the cheering died down, one of the participants took the microphone and made an impassioned plea. And what they said is, don't forget what you've seen here today. Don't think of us as a disability, but think of us having a different ability. And those words really struck me, and it galvanised something inside of us to explore employing autistic people further. And that person was Rochelle Johnson, who I was going to be presenting with today, but unfortunately Rochelle is ill, so I'll be continuing without her in that case. But we began to dream at ANZ, what could we look like if we publicly and intentionally celebrated and supported autistic people, their skills and talents. And we spoke to many pioneering organisations, service providers, as we sought to learn for ourselves what we might do in this space. And there were a couple of key things that formed up as principles as a result of that. One of them was that we wanted to foster an environment where autistic people could build thriving careers and develop a business plan with a compelling case based on productivity and not charity. And thirdly was to focus on skill sets that had proven to be successful as part of our first cohort. And I know that in some of the early questions that have come, one of those is around, are we doing something outside of technology? And we're not at the moment, but we certainly have planned and developed the program around it being available to anybody with autistic talent and gifts in an area that we may be able to employ in the bank. So technology is where we started, but it's certainly not where we plan to finish. One of the pioneers that we did talk to and really impacted and impressed us was JP Morgan, and partly because they're a large US bank and we typically follow banks, but at the same time because they'd done quite a good piece of research around putting a non-autistic and an autistic testing team together, and in that it was quite interesting to see that the autistic team was around about 48% more productive, and that was quite a compelling part of our business case in relation to our business case being about productivity and not charity, as I said earlier. The other finding for us is that we really felt that if we were to make this program a success, then we needed to partner with someone who had been pioneering this and had a view to what was a successful way to do it. And we did that in a way that we found someone with similar values and mission to shape a workplace where autistic people thrive. And so the Spectrum program at ANZ was born in partnership with DXC, and it was based on their highly successful Dandelion program, which, as many of you might know, has been run in federal government departments of Home Affairs, Human Services and Defence. Each team has a leader, and overall we have an autism spectrum consultant, and the whole group is known as a pod. And so the team leaders work with our ANZ team leaders to ensure that there's a flow of work, but also to train the team in their chosen skill. And we looked for people that had an interest, as I was saying, in technology, specifically in cybersecurity or in testing. The autism specialist helps manage all of the critical social interaction, communication and relationship building, and already people think we've been up for 6 months, but we've actually had the people on the ground doing work for about 2 months, and they've already shown enormous value in being able to help people navigate the building, navigate different situations, meetings and so forth, and so we're really pleased with how that's going. Outplacement happens within sort of the first year, and that is people moving out of the pod and into the team for maybe a day a week, 2 days a week. And over the commitment of the program, which is 3 years, between the ends of year 1 and 3, we expect to see people fully involved in their teams and actually move out of the pod altogether and be self-sufficient in their team. So in terms of where we are today, as I said, we started the journey in October last year. We've been running for about 6 months, 2 months in terms of the team being on. In fact, we've just celebrated our establishment milestone. We had the executives and the team together for a morning tea, and I was talking there, and one of the things I said to the group was how amazed I was at the progress that they've made. And I reflected on when I first met some of them, there was such great anxiety that they couldn't take a phone call to talk about the program, let alone negotiate public transport, navigate the ANZ Centre and even give public speeches. So it really is quite incredible where people have come from in that sense. And so I wanted to just give you a few of the valuable contributions that we've already seen in those couple of months that the team have been working. The first one is that one of our teams already analysed over 1,000 fields in 60 tables of one of our applications and been able to memorise those and picked up a number of the issues. In fact, they've even been able to go back to the developers and tell them how they could code this to be a more efficient and faster application. In other areas, they've identified over 20 discrepancies in production code and design documentation. Those things were originally missed, and they weren't particularly obvious in terms of the misses, but because the team is so good at understanding the context and the interrelation of the different parts of the application, they pick those things up. In our cybersecurity space, our team looks a lot of the first line vulnerability type work that comes through. And in the first couple of weeks, one of our guys had already memorized 100 of the IP addresses and corresponding server names, and in quite complex spider diagrams was already able to work out where the problems were. So, I mean, they're amazing things. They're great output. We're very excited about that. We're also excited that those things help us build a great business case that other organizations can use. But I think the two things that really touch me in terms of where we really see the difference is that one of our team members, when they first started, would just not really speak unless directly spoken to, but now will join in the conversations without being prompted, and is even running a trainer of trainer sessions. And you know, when we hear about sort of the family friends catch up, and if you imagine the great Aussie barbecue and people say, what do you do for a job? That's obviously been a very challenging conversation in the past, but you know, now we're hearing about the team being proud to be able to say that they work at ANZ, that they're working on the mobile payments platform, they're working on other important work, and they can hold that conversation. So those things are really exciting us in the sense of seeing people come into the workforce doing meaningful, valuable work and actually receiving something out of that for themselves in that longer term of building a career. But our vision is really much bigger than a program, and it's why we partner with DXC in a shared purpose, because we collectively believe we can make a difference in the autistic community in and around the productivity of organisations as well by scaling up internally, and we are looking at that at the moment in terms of what the next cohort might look like for us. We're considering the different disciplines that might be, and we're looking at opportunities outside of IT that may work for us. And also scaling out. So a big part of what we're doing here is really encouraging and inspiring other organisations to consider employing autistic talent, and hence the reason that I'm happy to be involved in this webinar and many other speaking events and made ourselves a reference site for people to come and see what we're doing, because ultimately we want to see increased employment in the autistic community. We've started the conversation, as I said, around what that next cohort looks like. I don't have dates or full plans for that, but when we do, we'll certainly talk more about that. We're really about breaking the barriers. The more barriers that we can bring down and the more organisations we can inspire to employ autistic people, the better for the community and I believe for the economy as well. So the desire of my team, myself and our organisation and partners is that we'll leave a legacy far beyond ourselves that doesn't just help a community but changes a nation. Now, many of you would know I'm a father of an autistic son who has inspired me to do whatever I can to improve employment for autistic people, in the hope that when he's ready to enter into employment, it'll be a much more friendly and accepting place. And today marks a major milestone for him and our family in that he turns 13 today, so he becomes a teenager, and I have no more young children in our house. So I just wanted to make a shout out to Josh and wish him a happy birthday. And thank you very much for listening this morning, and I'll be hanging around for the questions and happy to answer any of those when we move to Q&A. Thanks, Andrew.
Thanks, Matt, and please pass on our best wishes to Josh as well for his 13th birthday. Our next presenter is Dr. Anna Urbanowicz. Anna is an Autism CRC Postdoctoral Research Fellow based at the Queensland Centre for Intellectual and Developmental Disability with the University of Queensland. She trained as an occupational therapist and has worked with children, adolescents and adults on the spectrum. Anna has a keen interest in working together with adults on the spectrum to enhance their quality of life, including their health and wellbeing. Anna has recently received the highly prized Fulbright Postdoctoral Scholarship to work on improving the hospital experience for adult patients on the autism spectrum, and many congratulations to Anna on that award. For her Fulbright Scholarship, Anna will work with a team at Portland State University in the USA, who bring together the academic and autistic communities to conduct research relevant to the needs of adults on the spectrum in a true demonstration of co-production. This team has developed an online healthcare toolkit, and Anna's project will adapt this toolkit for use in hospitals with the aim of improving the hospital experience for adult patients on the spectrum, their support team and hospital staff. Thanks for helping us out with today's webinar, Anna, and over to you.
Thank you, Andrew, and good morning, everyone, and thank you for joining us today. Today, I'll be talking about a specific research project that I've been working on for the past couple of years in my role as a postdoctoral research fellow with the Autism CRC. But I work on a number of research projects around improving the health and wellbeing of autistic adults, and I'll tell you a little bit more about some of the other projects that are happening at the end of this presentation. Before I get into it, I would also like to acknowledge the other Program 3 sites, so our colleagues at La Trobe University, colleagues at the University of New South Wales and colleagues at Curtin University in Western Australia who have helped recruit participants for this pilot trial of the Autism CHAP. So in today's presentation, I'll spend a few moments just talking about the background and the health of autistic adults, what we know at the moment. The aim of this particular research projects and the methods that we use to collect our research data and analyse our data, some preliminary results as this study is ongoing, and some early conclusions and future directions for our work. So autistic adults are usually more likely to experience higher rates of physical and mental health conditions in comparison to adults without a diagnosis of autism. Physical conditions can include gastrointestinal problems, and mental health conditions commonly include anxiety and depression. Autistic adults are also at risk of increased mortality, and they have difficulties accessing adequate healthcare. So a lot of the research in this area talks about how a lot of adults experience difficulties with communicating with their health professionals who may not provide information in an appropriate way. They also experience sensory sensitivities, which may make it difficult to access healthcare environments, particularly hospital environments, which can be very busy and distressing. And also a lot of adults talk about having anxieties or fears around particular health procedures that they may need to receive. Autistic adults also experience unmet healthcare needs. So in a study that Nicolaides and her colleagues did, they asked autistic adults about whether in the last 12 months, was there a time where they felt they needed some healthcare but were unable to obtain it? And adults said that there were times where they couldn't access healthcare, and particularly mental health care and needs around prescription medication. All of these difficulties may be compounded by the presence of intellectual disability. And some of the research says that up to potentially up to 70% of adults with autism may also have an intellectual disability. Health professionals also report a number of challenges when providing care to autistic adults, and these are at system levels, practice levels, and at training and education levels. So at system levels, health professionals talk about how there's overall a shortage of medical and non-medical services skilled in providing services to autistic adults. At practice levels, health professionals also mention how they experience difficulties with communicating with autistic patients, and they often mention that they are constrained by time, so they feel like they don't have enough time to get to know the person well and to be able to provide adequate care. And also sometimes they, the physical environments that they work in, they're not able to adapt to meet the needs of autistic adults. Health professionals also mention that they have a lack of formal training in working with adults on the spectrum, and that there are very few guidelines about how to recognise and address health concerns in this population. General practitioners are in a unique position to influence the health outcomes and healthcare experiences of autistic adults, particularly in Australia, where GPs are usually our first contact with the healthcare system. However, there is very formal training and support available for GPs working with autistic adults, and this raises the point that we really do need programs that help support our GPs and practice nurses that work in GP practices to support the GPs to improve the physical and mental health and healthcare experiences of autistic adults. And this particular study that I'm going to be talking to you about is involving autistic adults with an intellectual disability. So the aim of this project was to develop and pilot a comprehensive health assessment program for autistic adults with intellectual disability. And we wanted to see whether or not this paper-based tool, which involves an annual health check and the person going to visit their GP, whether or not this also improves their health and well-being. So the development of this tool was based on the Comprehensive Health Assessment Program, or CHAP, which was originally developed by Professor Nicholas Lennox. And it was originally developed for adults with intellectual disability to improve access to healthcare, enhance communication between the adult, their caregivers, and the GP or nurse, and improve integration of healthcare and educate everyone which is involved in the individual's healthcare. Nick led 3 randomized control trials to test the effectiveness of the CHAP tool in adults and adolescents with intellectual disability. And it was found that the CHAP was improved the number of health screening and promotion that was provided to individuals with intellectual disability, and it also improved the identification of unmet healthcare needs. So we thought perhaps if we adapted this tool specifically to meet the needs of autistic adults with intellectual disability, that likewise we could see these improvements in healthcare for autistic adults with intellectual disability. So we adapted the CHAP for our specific population by doing a review of the literature and also gaining feedback from advisory group members, which included autistic adults, caregivers, health professionals, and researchers working in the area of autism. What we found, or the way we adapted the tool, was that we added autism-specific resources to the CHAP. The review of the literature identified additional questions to be included, and these included questions around sensory issues, the diagnosis of autism, how the adult communicates, additional questions around their gastrointestinal health and eating habits. The advisory group feedback resulted in changing the language used in the CHAP. So the original CHAP tool uses third-person language, whereas we changed our tool to be first-person. We also changed terminology that we used around gender and human relations to be inclusive of people who are transgender or another gender. And we also changed our terminology around mental health, and we added a question about self-harm. So the CHAP is a paper-based tool, and on this slide I will just show you some examples of the types of questions which are included in the different parts of the autism CHAP. So the first part of the autism CHAP is completed by the individual and sometimes with the help of a caregiver, and it asks questions about their health history over the course of the last 12 months. So here on the screen you can see some of the questions that we ask around communication and sensory behaviours. And this is an example of the questions that we ask around the different body systems and how they've been functioning over the last 12 months. And we also have specific sections for male and female health. And we also ask detailed questions about family history of illnesses, epilepsy, the use of medications, and mental health. The second part of the autism CHAP is for the GP and nurse to complete. So once the first part of the autism CHAP is completed, the individual, usually together with a caregiver, attends a GP appointment, and the practice nurse may help with collecting some of the preliminary information to help the GP. So the second section asks the GP and the nurse to do a thorough health assessment of the individual. And so this is an example of the first page of the health assessment, and to see whether there have been any new findings in different areas of the bodily systems. And towards the end of the autism CHAP is an action plan, and this is completed at the end of the GP appointment. And it identifies any problems that have been identified. This may be that the individual hasn't had their immunisations and they're not up to date, or they require further screening and other health tests. And it also has space for who is responsible for that action and to ensure that the actions are followed up. And then at the end of the autism CHAP, we also include some specific resources and information for the GP and nurse to read, and we also provide links to further information for them. So in this particular study, it's a small pilot at the moment, and we are still recruiting participants. So at the moment we have 9 people recruited, however one participant has withdrawn. There are different stages involved in this project. So the first stage or the second stage includes a demographic survey of the individual, and we have 8 of those completed. And then we require the individual together with the caregiver to complete the first section of the autism CHAP, and then go to see their GP to complete part 2 of the autism CHAP. And then once the individuals have gone to have their appointment with their GP and the autism CHAP, we have received feedback from participants. So in this particular study, we've sought feedback from the individuals on the spectrum with intellectual disability themselves, where they've been able to participate in an interview, and also survey feedback from any caregivers which attended the doctor's appointment, and also GP feedback. So I'll just be focusing on the 5 autistic adults that have completed the Autism CHAP in these preliminary results. So they ranged in age from 31 to 57 years. 4 of them were males and 1 was a female. Over half lived in a domestic or family home, and 2 lived in staff grouped homes, and 3 of them finished year 12 or equivalent, and unknown for 2 of the participants. When asking some specific questions about GP visits in the last 12 months, they varied from 1 individual who hadn't seen the GP at all to 1 individual who had seen the GP once every month. And on average, these visits with the GP lasted 15 minutes, and all of the participants except for 1 saw the same GP consistently. And the individual participant number 2 there, who didn't see the GP at all in the 12 months and didn't have a consistent GP, was because that he was relatively healthy and his caregiver didn't feel that there was a need to see the GP. So now I will go through some of the feedback from participants, starting with some of the feedback from the autistic adults. And so I was able to interview 2 autistic adults. 1 interview was done face-to-face, and 1 interview was done over the phone. In regards to how the participants helped with completing the Autism CHAP, both of them helped complete the first part of the Autism CHAP, where their caregivers asked them the questions in that section, and they answered them. One of the participants was very good with dates and being able to remember the dates of different procedures, or when he last had his blood pressure checked, and things like that. And he mentioned that perhaps other adults may have difficulties with remembering these dates, unlike him. And he also became anxious when answering questions about cancer. So we do ask questions about whether or not anyone in their family has cancer, and we also ask about whether or not the individual, if they're over a certain age, have had bowel cancer screening. And for this particular participant, it made them quite anxious that they may have cancer. In terms of booking the GP appointments, both the support people rang and booked the appointment for these individuals, but one of the participants helped by providing the caregiver with some possible appointment times that suited him. So the next couple of slides are just some quotes from these participants. One of them felt quite positive about the Autism CHAP, and felt like it was a good thing for them to do because it made him aware of what he can learn from his mum and dad and the history of his family, and also learning about what could happen if his health was bad and to see what he could do better. The other participant, when talking about positive things about the Autism CHAP, said that he actually quite enjoyed telling people about all the operations that he had when completing the first section of the CHAP. So moving on to GP feedback, I have feedback from 4 GPs. When asked about whether they felt the Autism CHAP appointment was different to usual appointments with the adult, unanimously the GPs said that it was more specific and more thorough, and that they liked the addition of prompts and information that were provided. And a couple of the GPs said that they did gain quite a lot from the Autism CHAP, and that they now knew what to check for in this particular population, and that it expanded their knowledge on how to deal with these issues in autistic adults with intellectual disability. And some of the GPs also felt that the patient received better management and more testing as a result of having the Autism CHAP done. I have feedback from 3 support persons. 2 of these individuals were mothers, and 1 individual was a paid support person. So this quote is from a paid support person, and when asked whether or not they would use the Autism CHAP again, they said, "I suppose if we have to, although I would find the info at the start very repetitive if I had to complete every year, so that the info is historical and would not change annually." And this is a mother to one of the participants who felt that the autism CHAP process was not helpful at all. It took too much time and there was no benefit in it. Maybe if someone was unwell, it is a good way to screen for health issues, but it needs to be more simplified. It needs to be in simple language and pictures so that the person with a disability can be more independent as an adult. The same participant, however, did see some benefits in doing the autism CHAP for her son. He probably got some benefit because he really liked meeting the GP and the nurses. He thought they were nice and friendly and cared about him. As he really rarely gets sick, it was good exercise in building relationships in the local community so they know him and he them should he need to see them. So although we have some preliminary results, this study is limited at the moment because we do have a very small sample size. And we are still recruiting participants. Throughout the study, we did have some difficulties with recruiting autistic adults with intellectual disability. Some of the individuals in the study, live in group homes, and it can be quite difficult to recruit those individuals and work with individuals within group homes when there's a changeover of staff, and we really need the staff to help support this project because it is quite time intensive and requires a lot of support from caregivers. Initially, we also had some difficulties with engaging GPs in the project, but we therefore changed our processes, and now we assume that the GPs provide consent when they return the completed survey back to us. One of the barriers was trying to get consent forms in the first instance from GPs. So far, overall, there seems to be positive feedback regarding the autism CHAP. However, it should be further simplified to make it easier to use, particularly to allow autistic individuals with disability themselves to be able to complete part of the some of the sections. However, I think this project really highlights the importance of seeking input from autistic adults as well as the support persons and GPs when we're trying to develop programs which are going to be used by the adults themselves with the support of people and also their GPs. Just briefly, some future directions of where this work is going and other work that we're going to be doing in the near future. Our team is hoping to hold a consultation day in Brisbane in August this year where we bring together individuals on the spectrum, their caregivers, health professionals and researchers working in the area to really help us workshop what sorts of projects we should be working on in the future and what are the research priorities for the autistic community. We also recently had our new Autism CRC PhD scholar, Pia Bradshaw, start with our team, and she will be developing training specifically for GPs and other health professionals in working with autistic adults. And as Andrew mentioned at the beginning when he was introducing me, I will be going to the US to work with the Aspire team to trial their healthcare toolkit within hospital settings. And we also have an honours student working with us currently trialling the Aspire healthcare toolkit as is. It was developed for individuals within the US, but we're doing a small trial within Australia. So if anyone is interested in learning any more about any of these projects, please do contact me on this email or on this phone number, and I'll be happy to take questions as all the other presenters now. Thank you very much for listening.
Thanks, Anna. And hopefully we can get all our speakers back on now because we've got a couple of questions to throw to our panel of speakers. Thanks again to Anna and Matt for their presentations today. Matt, the first question that's come in is for you. As an employer and a parent, how do you think we can begin to assist people on the spectrum seeking work within the customer service industry?
Yeah, that's an interesting question. Customer service is a big industry. I mean, you can include banking in that. We see ourselves in technology as being part of that customer service. So I think that, and I was talking to someone about this the other day, but I think it's probably less about awareness and more about education and acceptance in organisations. And part of that is coming through a partnership with DXC, University of Queensland, Swinburne as we get neurodiversity hubs up within universities around Australia. And the purpose of that is really to improve the employability of neurodivergent or autistic people in particular as a focus. So that's probably one of the ways that we're addressing that. But I think it's really about educating organisations to the talents of autistic people.
Thanks, Matt. The second question's not specifically to any one of you, so I guess we'll pose it to all of you in a way. My 33-year-old son has a mild intellectual impairment plus an Asperger's diagnosis. What opportunities are there for him coming from your research? And I guess this question, in part at least, goes to the point that we are dealing with a spectrum, and it's important that we are developing programs that are of use to people right across that spectrum. Do you want to start with that one, Anna Kay, maybe?
Yeah, so I guess I guess it would be, to obviously, be able to better answer the question would be also important to know a little bit more about the individual. I guess, I mean, broadly speaking, I guess that not just the research, but also all the other activities that the Autism CRC, the organizations and we as researchers, do in the space will help to raise awareness, create, and also demonstrate the business case of employing, as Matt said, employing people with autism according to their skills. I guess what is coming out of the research, and we're actually and this is part of research, part of also collaboration that we're doing with the Neurodiversity Hubs. I think it's also what will be part of that is also developing and refining the assessment tools that organizations are currently using. And I'm assuming Matt, you're using probably tools, and then based on what the DXC has developed, and there are tools to assess in each individual, because as you said, we're talking about a spectrum, so each individual's specific skills and support needs, and then so that we can develop a more individualized a profile and work a profile for that individual. Part of the hubs, for example, and the work experience program that I was alluding to, is that is also what students will come out with, right? So they will come out with, after the 3-year the 3-week program is not just a training program, it's also actually an assessment program that DXC runs to see how, and then gives back like a little, profile book to each individual coming out, so that they can, go back and further work on their employability skills and et cetera. So, obviously to answer that a bit more specifically, we would need a little bit more detail, but I think generally, this is, I think, how we are kind of, working in the space to help individuals like this one.
Yeah, I think you make an important point there, Anna, that with the number of the programs that we're talking about here, rather than focusing on diagnosis or also the challenges, or in the old language, deficit, it's very much trying to identify, it's a strengths-based approach as much as anything, to look at what the skills are of the individual in a person-centred approach to these programs. Anna, did you want to add to that?
So all our research projects, we include individuals from across the spectrum, so autistic individuals with and without intellectual disability, and a couple of our research projects specifically involve those with an intellectual impairment. So if you are interested in learning more about the different projects that we are running around health and wellbeing, please do email me and get in contact, because I'm sure there would be a number of projects that you and your son could get involved in with us.
Thanks. Just one more question. That's just come in. Is there any help available for someone who is on the spectrum, who has a Bachelor of Business majoring in accounting, but unable to work due to having a breakdown because of a lack of understanding and accommodations and pressures in the workplace? It's a very specific question, but I guess I'll throw that open, particularly to those looking at the employment side of things, to perhaps comment.
Absolutely. I think looking at that profile, it looks like the exact target group that we're actually looking at. I mean, we are looking at, people who actually have the skills, but who have so far, because of, potential lack of understanding and current barriers, actually not been able to make it into sustainable employment. So that's exactly the type of group we're looking at. The bachelor, depending on what kind of university the student is from, hopefully, at least in the ideal scenario, there might be a neurodiversity hub coming up or being established at that university, or if it's in the state, they might be able to be associated with a neurodiversity hub that they would then specifically be able to work to help the student. Matt, do you want to add on?
Thanks,
Matt, we can't.
Can't hear from him.
Can't hear you, Matt.
We've lost that sound, unfortunately.
Here we go.
Try now, Matt.
No. Oh.
There we go. It looks as though it's been a couple of days of technical difficulties across the corporate sector. And
can you hear me now?
Yes.
Yeah.
Hear me now. Now the lights have gone out. What I was just going to say quickly is that I think this is a really important part of employers thinking about autistic people when they're looking at roles, and not necessarily doing that from a disability perspective, but just thinking about this diversity of thought, this diversity of talent, and looking at opportunities where autistic people would really fit. And part of that is being able to understand the different interests that autistic people have and thinking about it in that way. And I think that that's why things like the Neurodiversity Hub and other programs that are going on that really start to tailor and look at the way that the types of roles that organisations have got and the people that are interested in them are starting to make those connections. So while I may not have a role directly around that, I think there's great hope growing for people in that way as organisations start to think about this differently to what they've done before.
Okay. Well, that's our questions and that's our time. And I'd really like to thank you all again, particularly our presenters, Anna and Matt, for sharing your research experiences and expertise with us today. I'd also like to thank all of our listeners who've joined us. I hope you found the webinar informative and insightful. I remind you that a recording of the webinar will be available on the Autism CRC website in the coming days, and I encourage you to tune in to our next webinar, which is focused on the school years. That'll be held next Tuesday, the 24th of April. If you'd like to know more about Autism CRC's work across the lifespan, please visit our website, where you can also sign up for our e-news and participate in some of our studies if you choose to do so. You can, of course, also follow us on social media. Once again, thank you to our speakers and everyone that's joined us today, and I hope you enjoy the rest of your Tuesday. Thank you.
Thank you.
Thank you very much.
Thank you.
Bye.